We're going to be discussing now new figures that raise serious questions about equality in Irish cancer care. A Parliamentary Question from Aontú has revealed significant regional and social disparities in breast cancer survival rates, suggesting that where you live and whether you're treated publicly or privately can affect your chances of survival. Joining us to discuss the findings and what they mean on the ground are June Dillon, the Aontú representative for Clare, and in studio I'm joined by Anne Murphy, the oncology nurse based in Tulla. And you're both very welcome to the programme. And June, this PQ has uncovered stark inequalities in breast cancer survival. In simple terms, can you take us through what the data revealed?
Okay, well, first of all, I suppose I'm going to give you the direct question that was asked so people are really clear on it. So the question that Padder asked was, he asked for the Minister for Health for the 5-year survival rate for breast cancer in each county in the state, and if a breakdown on survival rates was available across social classes and incomes. So what we found was that there was a disparity in geographical region. So with a spread of roughly 14 percentage points between the highest and lowest performing areas, and I'll go through a couple of them there now, and also surviving the most deprived areas was almost 5% lower than in the least deprived areas. And also that survival outcomes showed a 12% difference between women diagnosed in public and private hospitals. So what it showed, there was a graph that they sent out, and that between, breaking it down, I suppose between 80 and 85% survival rates, you had down between those percentages Limerick, Kerry, Mayo, Tipperary South and Clare. So Clare came in at 84.9%. If you're looking at the higher end of the 90 to 95%, you have Cork at 90%, Sligo, Kildare, Cavan. And then just out of interest, I looked at the capital, so Dublin North and Dublin South was 87.7%, and then Donegal, I suppose a rural area that we would consider kind of far from services, they have their own satellite breast cancer unit and they were up at 87%. So I suppose what it shows is that it's not about frontline failure, it's about political responsibility, and no level of dedication can substitute for the lack of funding that's out there. And I suppose we wanted to get this information out so the government can see it and solve the problem. And I mean, this isn't a new problem. I went into the Irish Cancer Society and I looked at their budget submission back for 2025, and they said at the time that there was 180 million hole in national cancer funding, and they were calling for an investment in the National Cancer Strategy with two main bodies, which were the Irish Society of Medical Oncologists and the Irish Society of Radiation Oncologists. And what they said, which was interesting, is that the National Cancer Control Programme's annual budget, of the National Cancer Strategy should have increased incrementally over the previous 8 years to be 110 million euros higher in 2024 than in 2016. But the actual incremental increase had only been 65 million. So as a result, then the cumulative loss was 180 million.
Yeah, there's a significant disparity there. And just to bring you in, Anne Murphy, I mean, you're working on the front line of cancer care. When you hear these statistics showing big differences in breast cancer survival depending on where a woman lives, what does it reflect what you're seeing in practice and what it says about the situation women in Clare are in?
Yeah, so what was said there that we're down at 85%. Like I think last year in 2024 across all the major cancers in Clare, I think we were less than 5%. We've a 5% disparity in survival rates compared to the next best that we should be, which is significant. And what is spoken about in terms of costing and funding to go in, because everything has a cost. So why do people have a poor prognosis, a poor outcome? And the outcome is based on what we would always say, early diagnosis, early treatment, early intervention, but also best practice, clinical trials, expertise, prompt response and good risk support. When you're living in a county Clare, for example, compared to Dublin, regardless. And I know the disparities over there with the lower socioeconomic status of some groups of people. But when you live in a county like Clare that has no, actually, we're serviced into Limerick and maybe Galway, we have very little voice in terms of what are the supports that are needed that people can get this prompt diagnosis. We're always going outside of the county to get diagnosis. We're going outside of the county further to get proper, like PET scans you spoke about.
And in terms of geographical location and travel, I mean, that plays that's clearly a factor as well. And in terms of whether you're living in maybe urban or rural Clare, and what do you see as the biggest barriers patients in rural or regional areas face when they're trying to access timely cancer treatment?
Alan, as we spoke many times about this before, Clare is a huge geographical mass area. It's one of the biggest in county. It's huge. For someone to get from Kilkee, Kilrush or Mullock into Limerick for treatment, what has changed in the cancer treatments in this country is that it is now an ambulatory service. People are coming from home and going home after their treatment. When I started in college 20 years ago, people were admitted, they were minded, they were supported, they were fed, they were warm, their families could leave them, come and visit and knew they were looked after safely. It's a huge change of the treatment modalities. People are moving in and out. How do people get there? What kind of time is spent in cars travelling?
Exactly, because imagine if you're sick, the travel takes it out of you as well.
It is. Look, if I could say and I'll just bring it back to my experience in a small cancer support centre in Aontú, Clare, that's fully charity, not HSE funded, independently. We don't tout for business. People come looking for help. We have people coming from Kilkee, Mullock, Lister and Varna that need to be in Limerick every single day for radiation treatment. Elderly people. Before Christmas, you had a GP on here that said that Ennistimon local electoral area was reported as having double the amount of deaths, I think, tumour related in our electorate. And I don't know who the GP was maybe that spoke to that.
I think that was Michael Keller who was speaking to us on that, yeah.
And you questioned why is that, and he alluded to it, that there's a lot of reasons, but we've an ageing population. Now cancer the biggest population of people with cancer are older people. And then we have the electorate that's twice the figure per 100,000 than it is in the rest of the country, which is significant. And what resources have put in where we can map the reason, and he suggests it's possibly age, but is it resources or support? Are people making decisions because they can't get to where they go? Are people elderly living there alone because employment and their significant others are working further away from them so they don't want a burden on them? There are huge implications as to our huge reasons why people make decisions on what treatment pathway they go. They don't want to be a burden. They feel they mightn't have the support. They make choices based on where they have to go. But we have the stats and we have the figures, but nobody's putting money into Clare to say, you know what, you're on your own. You need extra support to get patients to treatment and mind them. And
just to bring June back in, June, it might, the really tough, crucial, potentially life-saving decisions patients have to make might be made easier if there was more funding. But as you highlighted for us, there's quite a ways to go on that. And your party's calling for urgent investment in frontline oncology staff and binding treatment timelines. But how quickly do you expect that, if at all, to happen?
Well, I mean, I suppose, look, there's population growth was predictable, cancer incidence is predictable, complete underinvestment. So I suppose what we need now is to stop all this government waste. There's no accountability. They're building things. I mean, 180 million would easily have come from all the waste that between bike sheds and walls and all that, and security huts. So what we need is the focus is be on capacity, the means to urgently drive and recruit and retain oncology staff, the means to protect cancer treatment slots, ring-fence beds, and also that timelines are implemented, that they're not just targets on paper, and also the cancer pathways have to be insulated from the general system of congestion there, because cancer, it's not something that can safely wait. So on the longer term, I mean, it requires serious workforce planning aligned with the population growth and cancer incidence, and requires sustained investment then in the regional cancer infrastructure, because like she said, here in Clare, we have to go to either Galway or Limerick. So there's only 8 designated cancer centres, 4 in Dublin, 5 outside Dublin. And the radiotherapy services are only in Dublin, Cork and Galway, with some in Limerick and Waterford. So, I mean, it's very limited. And to have to travel, like the cost of getting anywhere. And if you have family, like Anna's saying, you may not have family to bring you, and the cost of parking, the cost of eating out, and also care. If there's a carer, if one of the family is a carer, they have to be means tested, and we've been looking to get rid of the abolition of the means test for carers. That still hasn't happened. But all these things, and the stress of being out of work, and many people don't get medical cards. It takes a while. They have to go through social work or help from the Irish Cancer Society, and they have to pay for medications. They may have to pay for aids and appliances. So these are the things that should be addressed. And I must say the social workers are fantastic, and the Irish Cancer Society as well, at linking people in and doing the paperwork and helping them with all that. It's such a stressful time, and what we need is more political will. Like I say, it didn't start today or yesterday. This is going on for years, and this underfunding has led to screening not being expanded. I mean, we can see there's a drop in the breast screening rates from a parliamentary question that went in September there. It was down in 2024 to 137,000. It had peaked in 2019 at 170,000. So the breast screening rates have decreased as well. So we need cancer surgeries are delayed. Radiotherapy services are working below capacity, and access to new medicines is slower in Ireland and other European countries.
Okay, so there's quite a lot that's needed there.
And that's from the Irish Cancer Society. That's not just me saying that.
And just to bring Anne back in on that, I mean, clearly there's a deficiency, a serious deficiency level there, Anne. I mean, what would you say to policymakers who might argue the system is improving, or these gaps are unavoidable, what can't be helped?
Yeah, well, no, look, June alluded to all the stats, and they're all the standards. Everything can be read on the Irish Cancer Society, on political statements, on information at a policy level, or the National Cancer Control Programme, etc. All those eight designated centres were allocated about 20 years ago. The population has grown exponentially since. Our elderly population, has gone from, in the last 15 years, from someone 76 to now 84. Cancer is effectively older people. We can track all the reasons why we have an increase in cancer incidence and lifestyle. We have lifestyle, fast, diet, poor. But what... for key outcomes, I'll come back to saying it again. Sometimes, you have to listen to what's happening to people. People need information to know when to go to a GP. They need to know if they feel unwell to go and get seen. For the last 10 years, particularly in rural Ireland, we're crying out, no GPs, no GPs. That is your first port of call. When people have no GPs, they end up in casualty. Every bit of research says that people that turn up with cancer, with symptoms, have late diagnosis of cancer. Why is this their first port of call, A&E, that they got so bad with pain that they didn't go to the GP? So somewhere in that line, there's a broken system as to whether it's access or fear or comfort. And that comes to education and support, which is a national policy. It shouldn't be in Dublin, it shouldn't be in the Dáil, we're a small country. We could roll out a very standard pathway of care for people's health. There's only 5 million at the end of the day in the country. Why do we need all these multiple
We could, but do you suspect we will? I mean, can you offer any sort of optimistic message to patients and families who might be listening on and may feel anxious or disadvantaged by where they live?
Well, the biggest thing that I have learned, particularly from the support centre and listening to people coming in that are outside of the hospital. So let's say very clearly, everyone in the hospital are working under serious pressure. It has got busier and busier. I'm hearing it all the time from my colleagues, from the patients. The time that people and nurses and doctors and social workers had to spend with patients to hear their story, to find where they could help them, is gone to nil to nothing. It's crisis management is what I can hear coming back. So resources, staff, trained staff, expertise, listening to the patient's stories. Not the stats mean nothing unless you put a person in front of it. And when you hear the person speaking, you understand it is a very simple things that are broken. Transport, food, someone to listen to, time, appointments, thought for where they're living from. I mean, the amount of people we've had that are being driven by the centre to go down for radiation to get there, to find out the machine is broken and nobody rang to say, and they might have travelled 70 miles, 80, 90, and they have to do it again tomorrow. Yeah. The machine being broken isn't the problem. That happens. That's things that happen in services.
The thought to flag it up to save them the
who is this
draining
and
journey.
Where do they live from and where are they? And so that's really, really important. I think you really need to listen to the patient. But I also think every county, and I know June had said, is it different where you live or, whether you're from a lower socioeconomic status, higher socially impoverished area. I mean, that's known in every area. People don't mind their health as well as they could. So resources going in to support people. But consequently, you have to ask. And unless you voice your and ask the reasons. You can make no assumptions in healthcare today. You cannot assume the doctor knows what's wrong. You cannot assume that they know you're in pain. You cannot assume that you're struggling. We as healthcare have to ask people, who are your supports and how are you getting it? But patients themselves have to not feel afraid to say, I need help.
Yeah,
and ask
just
for
come
it.
out and
just
say
come
it.
out and don't feel embarrassed and don't feel, that you're ungrateful or something. You're not. You're not a burden. Ask. The answers are there. But, June talks about all the amount and, social workers and everybody being have. There is not enough of them because we're seeing as many people that never got access to people throughout their cancer journey. And that's a broken system. That's a broken service. Everyone should have equal access to make a baseline assessment where they're coming from, what their supports are, and how we can get them through their treatment in a quick, safe, fast, efficient service with a good recovery to help them to go on and live a healthy life and put the cancer behind them, but to give them the best chance of managing all that treatment and surviving and, going on to live a good life, as I say,
Okay,
Yeah.
we do have to leave it there, but always appreciate you joining us on this, Anne. Thank you very much. Anne Murphy, oncology nurse, Tulla, and the Clare Aontú rep, June Dillon.